Okay, we have today's topic to be high risk pregnant women. The following women should be considered as a high risk if one or more of the following conditions are present. One is the age 17 years or under or above 35 years of age, ed- elderly primipara or above 30 years of age and multipara more than 4 pregnancy, previously history of abortion or stillbirth, loss of child within 1 month or delivery, cesarean section, prolonged labor lasting more than 24 hours, baby weight less than 2.5 kg, height 155 centimeter or less, weight or less than 38 kg before pregnancy or less than 42 kg at 34 weeks of pregnancy, severe anemic. Thus, the anemia of pregnancy, signs such as edema, high blood pressure, and albumin in the urine, unusual large uterus, vaginal bleeding during pregnancy, abnormal presentation during the last month of pregnancy, diabetes, herpes, and heart disease. Under the age, we are talking about high risks of, okay, we're talking about high risks of pregnant women. We first mentioned age is also a factor of high risks of pregnant women. You say adolescent pregnancy before 17 years of age has had has bad effect on the health of the mother and baby. This is because the pelvic bone of a girl below 17 years of age are neither still in the process of development. More importantly, they are not matured physically nor psychologically to undergo the stress and strain of pregnancy and labor. Labor may become prolonged or obstructed, resulting in rupture of the uterus. These young mothers are prone to deliver low birth weight babies. Then, a woman is pregnant for the first time after the age of 30 years. She might experience difficult labor because of stiffness of the pelvic ligament and rigid perineum. After 35 years of age, women are more prone to pregnancy-induced hypertension, postpartum hemorrhage, and abdominal presentation. That is under age as a risk factor years above. Then we are talking about parity now. The woman, okay, we are talking about parity. I'm coming. I'm coming. You can see me, right? Good afternoon, good evening. Hello. Thank you. Thank you for joining in. Please give me a like and a follow. Thank you so much. I'm grateful. Talk Again TV show. Kindly follow my show. At least we learn. We learn every day. Okay. One of the topic is high risks of pregnant women. We have discussed one of the factor age, and now we are talking about parity. The women who already have had 4 deliveries, gram multipara is more likely to get anemic and malnutrition due to depletion of nutrition stored. Do you understand? Thank you so much for the like. The incidence of postpartum hemorrhage is high in multiparous women. We also talk about past histories. The previous obstetric history should be carefully assessed critically, noting any condition which can put her at risk during the present pregnancy. If a woman has a stillbirth in the immediate present pregnancy, perhaps due to fetal pelvic disproportion or tight cord around the baby's neck, she may deliver a stillborn baby, and need a cesarean section. Such women are high risk and they should be examined after, often during the current pregnancy, and advised to deliver in hospital. If 3 or more of this last pregnancy ended in abortion, then cause of this abortion should be investigated and treated. Hello, thank you so much. Thank you for joining in. Please, I need more like. Thank you. Kindly follow my channel. Thank you. I appreciate. The death of an infant within 1 month of birth, gradually due to feeding problem, birth trauma and infection, low birth weight, or prematurity. Some conditions may cover again a next infant. Hence, some women who lost their baby within 1 month of delivery should watch carefully during the present pregnancy. If the present pregnancy labor was prolonged for more than 24 hours, the cause for this should be determined. Thank you so much. Thank you so much. More likes, more likes. Thank you. You can share my channel. You can kindly share my channel. We also have severe malnutrition. So we are talking about high risk pregnant women. Number one, we talk about age, two, elderly, preparun. Then secondly, we talk about previous pregnancy, such as abortions, loss of child, cesarean section, prolonged labor, the baby weight that is less than 2.5, the height, weight that is less than 38 kg before pregnancy, and less than 42 kg at 34 weeks of pregnancy. Then the last one, we have severe anemia. So now we are talking about severe malnutrition. Women measurement like the height and the weight of the woman are utilized in screening high-risk mothers. Those women who are stunted, whose weight is very low before pregnancy, whose pregnancy weight gain is poor, are prone to delivering a low birth weight baby. Nutrition supplement during pregnancy can reduce the incidence of low birth weight of severe malnourished. Most of the cases during antenatal, we have noticed more of let me say few though, because the numbers of those that are their weights are okay, they are much compared to the ones I've seen one during last month that her weight was so low, and she was around she came to register last month. The same day she registered, we checked her vitals, we checked, and she was underweight. Even with a 32 weeks old baby, we have to make a referral to the general hospital where follow-up care can be done, because the primary healthcare center has limitation. So when we see some all these cases, immediately we make a referral and make sure that that patient need a follow-up care in the central hospital. So most times when we call them back, we make sure that they have seen a doctor, they are following them up, and we check on the patient. That is the follow-up we normally do, and we call them after they have given birth. They come back and they continue their immunization in our center. Thank you so much. Kindly give me a like, share, so that others can learn too. So we also have something like large abdominal. A large features multiple pregnancy. Twin and hydromenous should be suspected when abdominal examination review or over distended uterus. This large abdominal can also be seen when there is too much fluid. That is, there is too much water. Let me use water inside the uterus. We have delivered a child that um whereby the uterus is there, it's too much. We have to send the woman for scan 2 times, and the presentation was okay, just that there were too much fluid. Before she was able to give birth, enough water came out from her. So the baby was okay, the mother was okay, both of them were alive. So they are just telling you what might also cause this. There also another thing, when you send them for scan, you might notice they are twin. You get? So we also have vaginal bleeding. Women with a history of antepartum hemorrhage are more prone to postpartum hemorrhage. Hence, these women must be managed in the hospital. First trimester bleeding may end in abortion, leading after 20 weeks, and can be due to operation, placenta, or placenta previa. So when such women comes to the hospital at first sight when you know that this is a rural area where we take care of, we help to avoid dangers or more critical cases when they come for their first visit in antenatal, and when all laboratory tests are being carried out and vital signs are being carried out for them. We do our normal abdominal examination, and we ask, have you people during antenatal or when examination, we ask them, thank you so much. Okay, what causes too much water in the uterus? Okay, most times when the woman actually takes more fluid, we also encourage them, when we notice such thing at first, we tell her to reduce her quantity, the quantity of water she takes in, the quantity of water she takes in. So sometimes the except is too much, and then we notice, let me just tell you what happened to her. When there were too much water, she was actually telling us, she's leaking down, that water is pouring out from her body. Where I checked her dates, she was her EDD, that is expected date of delivery, was exactly that week, and we sent her for another scan to check because her cervix was just closed, but we don't know where the water was coming out from, so to check if the baby was okay. So she went for another scan. The baby was intact. Her The position of the baby was cephalic. It was presenting with the head, and that same day she fall into labor. Man, the water that came out was much. When I mean much, our bowl was full, and the baby was okay, the mom was okay. Okay, so in that case, it's not everybody, not for everybody. Too much fluid, you drink water moderately. You drink water moderately, not too much, not too much. Everyone is not the same thing. Okay, there are some people that can take 2, 3, 4 sachets, depending. The way I can take water is not the same quantity you can take water. So, and she was not having any odema, she was not having any signs, she was just okay, because we carried out every analysis, laboratory test, her BP, her vital signs was just okay. It was just the fluid. Okay, because when we did our palpation, we noticed, we just told her, okay, just go for a scan so that we know. And it was hydroanemia, was like much fluid was indicated inside the abdomen. No much cause for alarm, because the baby's fetal heart was head and it was okay. It was okay. You get? So another thing that can cause large abdominal during pregnancy, maybe they have multiple twins. And another thing is, some scans are depending on the doctors that are in charge conducting that scan. We have a good specialist that does those kind of scan for us, and we have never make any mistakes. If there is something that is required for referral, immediately on the very first day of the of visitation, or as frequent as the person is coming for antenatal, first visit, second visit, or third visit. Yeah, water is good, water is good, but not too much, not too much. The same way they said take water during the daytime, like now you can take water, but when it's at night, you notice some people have these cravings to drink more water at night, and it's not too good. It's not too good. And when they take the water, immediately they'll just go to bed and sleep. You'll just go to bed and sleep. The way your organs, the way you are resting, the same way your organs are also resting. The kidneys are also resting a little. So what you do as a woman, during the day, in the morning, the afternoon, take as much as you can. Then during the day, you have to urinate often. Not at night when your body, you are trying to relax, you are taking enough water. You see some people drinking two bottle water. They will just finish at a stretch in the night, and they will just be going stressing their kidney, going to urinate. So it's not proper. It's not proper. So everything is supposed to be done in a moderate level. Thank you so much. Thank you so much. Thank you so much. Thank you. Then we also have, when it is very important, it is very important when they come to the antenatal for first registration, we ask them about their past history. Those that have given birth in our health center before, we know them. We have their cards with their record, their past history, how many children they have given birth to, whether there were complications like postpartum hemorrhage, that is bleeding after delivery or bleeding before delivery. So when we notice, there are always signs. We can't see a woman with odema and we can't see a woman with breech position and we allow them to be in the health center. No, we don't. So when we see such thing, immediately we make a referral. We have a referral in the primary healthcare center. We send them down to the general hospital. We also have we also have colleagues, like someone we can reach out to in the general hospital that is in our local government. We'll call them. We said, we are sending social person to you. Please take care of the person. Give us a feedback. Then most times we make a transportation system for the patient and tell them that, okay, this person is going to take you down to that place. You don't have to pay any money. We send the patient down to that place so that the doctor can take a look at the patient. So even most of them don't even know that they have one or two illness alongside with their pregnancy. So when we find out such cases, we make a referral. So in the primary healthcare center, we do safe vaginal delivery, and all praise to God that it has been successful. No loss of life. The mother and the child are okay and they are well. So if we see most of these signs that are deadly to pregnant women, immediately we refer them. Just like the case I told you I saw, that was last month, a woman that was weighing 35, was it 35 kg, a woman that is approaching, she's around 38 or 39 years old. This month she will complete 39 years old, weighing 35 kg, and she's closely 8 months plus. Immediately what I did was, I have to refer her because she's already underweight. Her BP was okay. Her weight was just so consigned to me, because these also fall at risk of pregnancy. So this is risk of pregnant women. Immediately we make a referral of concerning her weight to the doctor, for her to see the doctor in general hospital. Then she will follow up her care there. So that is one of the major things we prevent most of these things from happening. When we see it, we make a referral immediately. We can't allow you to just be there. So these are one of the disadvantage of those traditional birth attendants, whereby they don't have any clue about it. Instead, they will tell you that they can do it, and you are there risking your life. So knowledge is just everything. Knowledge is just everything. Thank you so much. I will prefer more likes from you. Kindly share my video. Kindly share my video. Thank you so much. Thank you. Please subscribe on my channel. We'll be talking more on pregnancy. And there's one funny thing I enjoy about delivery, or about anything pregnant women. If I tell you how happy I am most times when I end up being the first person seeing that baby, it's so beautiful. That experience is beautiful. I have always been grateful seeing newborn babies, just new babies. Sometimes I have to tell their husband to come in, at least come and behold your little baby before eyes will start seeing it. I'll like, come inside. There is a woman that she came from another state. She was not coming, she didn't register with us in antenatal, but she was knowledgeable enough to have her scan in her phone. So what she did was, she snapped it, and she had her scan in her phone, whether she came for a burial around that area. Luckily for her, when she came to the health center, we asked her, the first thing I asked her, do you have your scan with you? She said, yeah, that she snapped it, if I can use it, and she was already in pain. Okay, so as a health practitioner, we have some exes, like, because one, you might not know, you can't just attend to a patient when you don't know the past history, you don't know the circumstance of that patient, you don't know the health record, mostly the blood pressure, you don't even know anything about that person, and the person comes and you want to take such labor. Is really, really critical and very dangerous. Very. So immediately she gave me the scan paper. I saw it was cephalic. I told her, do you have any of your nurse number that where you go for your antenatal? She said yes. I said, okay, come place her on call. Let me talk to her. And luckily, that nurse was on duty. The nurse was able to tell me her blood BP, that is her BP rate from when she started till date, and her BP has been fine, because when we checked her BP was already rising up. So that one was, it was not causing more attention to me, because since the nurse were able to give me her previous record at an antenatal, we understand that she will definitely come down. So we just give her assurance, make her to relax, tell her when she has not even eaten, we told her to, we gave her food, because then she was not fully dilated, the labor was just starting. So we made her relax. We told the rest of our children, two of our children that followed her, we told them that they should be at one side. Her husband was not with her. They started calling on phone. Her mother-in-law, her sisters were around. So we made her feel very okay. She was happy to be with us. Before you look, she became fully dilated. So that has scanned, and the nurse that was on duty that picked the call, we do appreciate them for keeping good record. So it's a nice one. They say, why is CS so common at the hospital these days, and how can someone avoid such hospital that pushes for CS just because they want more money? Okay, for CS, like another thing I will say is, depend on if the person is a priming. A priming is a first time mother. Like, for example, you are saying this is the first time you're taking in, this is your first baby, you have not pushed before. That is a priming. Someone that have not pushed before, this is your first delivery. Most times a priming, their first deliveries, I won't lie to you, it's is on God. When I mean on God, is because every woman have their VG, how their VG looks like. You get? So some are very, very, very difficult at first. The times it takes, the stress, some don't have that energy, that strength. That was why I was talking about age, concerning age at risk of pregnancy. When I was saying below 17, 30 years and 35 years. Okay, some will not have that strength. Some, the moment it's clocked to 35, their blood pressure is already increasing. And for you to avoid it, you have to place such person on CS to help the mother and the child. So it also depends on that person's on that particular person. So that is the safest. So you can't tell a woman that is 35 to come and push. Only the tension, maybe it's her first child at that 35, the tension of it can elevate her BP. So you place them on CS immediately. And sometimes the priming, that is their first time, maybe the priming is on that age. Let me say it's not even up to 18, she's 16, 17. It's not that they cannot push, but that's their pelvic bone, that their muscles, that it is not strong enough. We know there are a lot of them giving birth, but we know the consequence of all those things. So it is much better if a doctor detect that you have to go for a CS. It is better you go for a CS. If it's vaginal delivery, they said you can push, they have checked your history due to the questions they are asking you, and you have given birth before, you have not given birth, and they see that your health, your vital signs and your health, your age, your weight and everything can go along with it, fine, no problem, you can go through vaginal delivery. Okay, so it's not that they are pushing for more money, they are pushing for more money or anything. I understand, but it's just to be on a safer side. When I started taking deliveries at first, though I started with a priming, her first time. So when I saw it, I never knew. I was saying, is that how the stress was, like taking much time to push a baby, you're trying to help her, it wasn't easy. I was thinking that was how almost all deliveries are when I started. But as time goes, we're having multipara, those that have given birth to 4, 3, 5. It was becoming so easy day by day. Then when a priming comes, a priming that have not given birth, you now say, oh, you're not like, you want to go back to that stress again. When a priming comes to your hospital, not all priming, please, not all priming. it now looks like how will I say, some priming cooperate very well. When I mean cooperate, they have the strength, they have the energy, they understand the assignments that they have to push their baby with all prayers and support from us, and paying attention to what we are telling them to do. They will do it. They have that strength. But you can also see a multigravida that is 31, that is a 28, giving birth to how many children, but still they still cannot cooperate. They are just like priming their first time. They will just be shouting. Some will not be able to respond to you. Some will tell you everybody threshold of pain is different. Is different. Okay. So don't say that because they want more money. That is why we encourage women. The moment you're pregnant or before you get pregnant, try carrying out simple exercise. That is why antenatal is good. Antenatal is very good. You try and do some mini exercise. You can take a stroll early in the morning or in the evening. Take a walk with your husband. You can take a walk around your house. Make sure you take a long walk. When you're tired, you rest. Then during antenatal, we also teach when to eat and when to reduce the quantity of your food, your meal. You get, when there are weight that your child will get up to, we start telling you, I need more likes, thank you, please share the, please click on the share button, thank you so much, click on the share button for me so that others can also join. Thank you so much. Thank you. I do appreciate. This is a Talk Again TV. I'm a registered community health practitioner. I work in the primary healthcare sector in Nigeria. So you can ask more of your question. So that is for that. So labor and delivery is actually very wide. It's actually very wide. So don't think that way. It's safer. There's a friend of mine that I encouraged to go for a scan. See, there's so many places that can, like, don't allow friends, family to mislead you to do something that is wrong, except they are under medical field, and make sure their verification is, they have verified very well. Yeah, to be frank with you, all my first time mothers that have given birth, they have no tear. They have no tear. There is all on God. God has been doing it. God has been doing it. All glory to him. They have no tear. I don't know how God did it, but there's always procedure when carrying out. You try to guide the puperum, that is the space between the VG and the anus. You try to guide them very well. And there's the one I took, that was before I took my off from work. She bought, we have a list of items we tell them to buy. When I was using the oil on her, the lubricant for her, for her baby, I told her this lubricant, the oil, that is the lubricant we use for her. I told her, this tool that you bought, can I use it freely on you? Hope you will not say, this nurse finish it, because generally most of our clients or our patients refer us to be nurse. I'm a community health practitioner. Okay, so gradually a lot of people knows about community health practitioners. Some refer you as a nurse, and it's not a bad thing, because it's just like a care given to those of our patients. So I make use of the oil very well, and I try to guide them very well. And also, God is in your heart. Even in your heart, you'll be telling God, this is what you want. It's a good record, that is a good thing, and all thanks to him. When the baby comes out, I will tell the woman, can you see? Even to the extent, I will show you my colleague, you see, this is how you guide them to avoid tear. I don't like priming having tear. I don't like it. If it's a priming that I know that the space, if I notice when you come and say you have labor pain and you have not gone far, you have not dilated so far, I am checking you, I'm doing VE on you, VE on you, vaginal examination. I'm doing it on you. And I noticed it's not that free. Like, it's not something my hand, like, everybody's hands are different in size, you understand? Like, I don't have much, my hands are not big. My hands are not big. But I know how I check. If I tell you, this thing is not something that, and mostly when I check your scan, the size of your baby, the weight of your baby, when I see your baby is big, when I see that you're already getting 3.8, 3.9, or even maybe 3.94 kg, I'll say no, 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 no. Because that period you did that scan, maybe it was just 2 weeks or 3 weeks thereabout before you came for labor. Automatically that baby has added. That child has added. So what I will do, I will tell you, ma, even during the antenatal. So that is why I hardly have that case. I used to inform them on time. When I see that you're already 7, 8, 9 months, I will check your scan. I do check all my antenatal women. I do check their scan, and their scan are within. You see their babies 3 kg, 3.9, 3.8, 3 kg, 3.2. So even before they get to their EDD, some are already 3 kg. Some are already 2.9, 2.8, 2.5. So before that day of the delivery, you start seeing the baby is 2.9, 3 kg, 3.1. So I avoid such cases. So I help to give health talk. That is where health talk comes in. Please, more like and share. So I have to give more health talk on them and tell them, this weight your baby is having. I open up to them. I tell them, this is your weight of your baby at this 8 months. It's okay, oh. It's okay, oh. Don't go and be drinking too much this, too much Pepsi, too much tea. Don't abuse your food. Don't be eating anyhow, because when your baby big more than this, because before now, when they did the scan, they are not yet in labor. Maybe before they will fall into labor, maybe extra 2 weeks. Just imagine a woman that had a 2.9, before 1 or 2 weeks the baby have added to maybe 3.1 kg, 3.2 ahead, the woman can push it. But when the one we push was almost, maybe it was 4 point something, she has delivered. Was it her number 5 or number 6? The baby's head was big. Not even the baby's head was big. And the good thing is, do you know when someone is free, like, you have that thing is, this child will pass. This child will pass. Like, there's no way this child will pass. There are some people you say, no, 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 this child cannot pass. Mostly their passage when they are coming out, you say this child cannot pass. But this one, I said this child will pass. There's no way. After she was being guided and with enough lubricants, the baby came out. The baby was weighing, was it 4 points? I've forgotten. Baby was so big, looked like 2 months old baby. So then when I heard about her history, that her baby used to be big, most of her previous children, when I was immunizing some of her children are looking big. And she's not big, she's very slim and tall, slim woman and very tall. But her passage was very free, and it was free most, and it was very free. Let me use that word. It was very free. Why some people, when you try to put your hand down there, some places are so stick everywhere, so stick. You try to battle yourself during delivery. So it's not every first timer that have tear, okay? It's not every first timer. Depending how you were guided, and depend on your VJ. Okay, that is why they said exercise very well before your delivery. Exercise very well. If you don't have that rolling, and what is it called, that rolling this thing, you do a squat. You take a walk around your house, you do squatting. Exercise with your husband too. Exercise with your husband too, very well. Thank you so much, Ifunanya. Thank you so much. Thank you. I hope you have subscribed to my channel. I do appreciate. I'm a registered community health practitioner now. I work in the primary healthcare setting in Nigeria. Thank you. Don't be scared. If it's your first time, have it in mind. There's something I always tell them, that train your mind to know that I am giving birth. The moment you start having baby, the moment you want to deliver, you have your mind, have that mindset that you want to push, and your baby, you and your baby will be okay. You both will be alive. You can push it, you can do it. Tell yourself you can do it. And remove that fear that anything the nurse or the midwife is telling you, or the registered community health practitioner is telling you, the position, you ask them. If you have forgotten, say, please, how can I place my leg? Should I do this? Should I do that? Nurse, please, midwife, tell me how to position my leg very well. Or tell me, is this position I'm doing, is it bad? Is it good? Ask them. I know you will be in pain, but it's not going to be easy. It's not going to be easy. If you're well positioned, your baby, there are some people, the way they will be, the pain will not even allow them to be one place. And the child inside, most times when their amniotic sac have ruptured, meaning the ball inside the child, the ball that the child is inside, that contain water, the way that thing has ruptured and some are still inside much, the child will be drinking water. And depend how you start staying along the bed, moving from, you know how restless they are. So we'll be trying to make sure that the woman still in a good position, so that the baby can come out on time, so that the baby will not drink excessive water. And everybody is also trying to prevent delay, so that the baby will be, the mother and the child will be okay. Thank you so much for the like. Thank you so much. Thank you. Hi. I do come every day to say one or two things concerning health, life in general. So kindly be on, put your YouTube on notification. When I call me, you can join me. Thank you. Thank you. Thank you. So tomorrow I'll be right here. I don't know what time, Sha, but I'll be right here. Just put your notification. Kindly subscribe on my YouTube. Thank you so much. Thank you. I'll be going now. Bye. Bye. Ifunaya, thank you. Thank you. Hope you are subscribed on my channel. Thank you so much. Bye. Okay. God.